The death rate might be easing in aged care facilities, but the depth of problems has been laid bare over the past week. In a fiery grilling at a Senate hearing, Aged Care Minister Richard Colbeck resisted calls to resign.
Workers have given up on you, family members have given up on you, residents have given up on you. They've watched you do your job and nothing changes.
Well, Senator, I disagree with you that nothing has changed.
Now, more than 700 aged care residents have died with COVID in the first 7 weeks of this year alone. 25 aged care homes are now being helped by 133 defence personnel. That's still well short of the promised 1,700. We're joined this morning by aged care management consultant Michael Maher. Michael, good morning to you. Your companies provide technical and professional expertise when facilities are struggling with rosters and compliance issues like that. How do you feel about the Defence Force going in to try and help clean this up?
I think that when you sign up for the military, you expect to go and help Australia in many ways, including if there was a national disaster. But I'd say that for most defence members, they would be more likely to think that that's a Cyclone Tracy type of thing rather than substituting workforce in aged care. It's not really what you sign up for. The challenge is, though, aged care work is a specific thing, and so do the defence workers have the kind of empathy required. And even at a clinical level, a doctor is a doctor and a nurse is a nurse. Doesn't really work in aged care. Defence clinical people are designed to work on youth and trauma, whereas aged care is about the elderly and maintaining long-term health. So I'm not sure how well it's going to work. They need the help, but is that the right solution? I'm not sure.
I believe your team has found nursing home staff suffering post-traumatic stress disorder because of what they've been through. Is that right?
That's correct. The aged care workforce was at breaking point prior to COVID. So the amount of things that have come through COVID to affect workforce have just been the proverbial straw that broke the camel's back, from the loss of international students and international workers through to staff having to be furloughed because they were COVID positive or close contacts and going into isolation. That has just put it through breaking point. And now you have staff who have post-traumatic stress disorder as if their troops been in battle. They're working at a lot. We've been in homes where they're working at 50% capacity. Those staff are trying their utmost, but it's impossible to deliver the levels of care required with that many staff. And it's not through want of trying or the organisations trying to find new staff. They're just not out there. You can't conjure up thousands of aged care workers at a moment's notice, unfortunately.
Yeah, we've had everything from a white paper to a royal commission. What do you think needs to happen now, Michael?
I think there needs to be a fundamental change in a number of areas, but I've drilled it down to 3 areas. First off, the economic model. Moving away from large 120, 150, 200 bed homes into small community-based housing where people, say 8 to 10, live together in a house. Even if there's 20 houses on a property, it would help with the community feel. No one wants to live in a big hospital-type scenario anyway. And it also helps with, say, with a COVID outbreak from infection control. Second, to have a practical placement system that connected the training providers through to the organisation so that everyone got a practical placement, they all graduated, and there were a lot of job offers that came out of it. We do this here in Victoria for nurses, or the universities on one side, the hospitals on the other, and it allows everyone to basically graduate and get a job. We need that in aged care because we have too much attrition from people who don't get a job straight up, and so they return to the industry they were in before. And the third one is a common credential. A place where an aged care worker credential where they can get once their visa, their Cert 3, their police check, COVID vaccinations, etc., all ticked off, so they can go and work for multiple homes or move around without having to always be re-credentialed or having to show that data again. The time to effectiveness for new workforce and working for multiple employers would increase dramatically.
Michael, some great ideas there. Certainly something needs to be done. Thanks so much for your time this morning.